Good morning, viewers. I thought while I'm treating Harriet, I'll explain a few things that physios see on patients that are indicative of a problem in the area. And one of the few things is when you look at a spine on the person, they shouldn't have valleys or hills, is what I like to term it. So if we have a look at Harriet's shell, I don't know if you can see from there, but she's got little nodules that stick out. So if we had to take this as the spine in the middle between the nodules, if the muscles become raised on the sides like this, I call it you've created a valley on the back, and this can cause pain. So what one would need to do is one needs to release the muscle spasms on the side of the vertebra, which would then flatten it out. So when you look at a spine, it must evenly just gradually curve down into the lower back, and then have a slight dip in the lower back, and a slight roundature on the middle of the back, and then a slight curvature again into the neck. So it could go the neck, the middle of the back, the lower of the back. And if you have anything where the middle of the back is too curved, then we call it a kyphosis. If the lumbar is too far in, we call it a lordosis. Sometimes you can have a lumbar kyphosis, in other words, the lower part of the back, instead of being like that, is like that. And then, or it can be flattened out, and the neck can be very bent forward or absolutely straight. And that is all indicative of muscle spasms in the area. So you'd want to release the muscle spasm. So you'd often, if you took an x-ray of the neck, if they say the curve is too straight, that's due to muscle spasms on the back of the neck, pulling the spine back and straight. And you go in and you release the muscle. And if the neck is too far forward, you'd get a severe curve on the thoracic area here, indicating that there's a lot of muscle imbalance going on there. And you need to release these imbalances to get the spine to be a gentle curve, rocking backwards and forwards, gently up and down. No bulges on the side. If you've got bulges on the side of your spine, then that's muscle spasm. So we go in and we treat that. The other thing that one as a physio does is we'll slide our fingers up the sides of the vertebra, and where they part is that level has got the muscle spasm on it. So you'd want to treat that specific level. If you go and you look on MRI scans, and that level will be actually the level that's influenced with a reduced disc space or underlying degeneration in the area. So we can pick up these telltale signs before the MRI scans show much changes, and that's where you want to focus on those areas to release the spasm in that area, to reduce the impact of the pressure on the disc. Other signs and symptoms that we'd find is l'orange peel or cellulose. So if you have cellulose in the area, be it in the arm, in the leg, in the lower back, it's indicative of muscle spasm underlying, and there's a problem in that area, and one needs to release the muscle spasm to release the problem. Also, you will get grooves in the area. So if you have a look on your skin, if you have any marks, you'll see it on people on their neck, they get deep grooves on their neck. It means that that muscle is specifically tight in that area, and it's causing like a hinge joint, which would make it groove. So if you go in and you release those muscle spasms on the neck, often you'll get rid of the headaches as well, because these muscles refer to the headache. And by releasing the front of the neck, you will then release the grooves. And if I actually stick the needle in where the groove is, I will elicit the same headache that the patient is complaining about. Harriet is done. And also what you'll find is if I take a pen and I poke it on the arm, I've now been wearing my bracelet, if you have a look, see that it's left a mark. Now that's just because it was sitting there and it got pressed against my arm. But if that mark remains for long periods of time, it will be indicative of trophodema, which means that you've got reduced circulation in the body. And it could be due to underlying muscle spasms in the body, which can cause pain in that area. And that's why with chronic pain, you treat the entire body, looking for all these clues as to what is going on. And this will make you better. So you want to do that, and go and see a physio if you suspect that you have any of these problems, or ask him to have a look, see if you've got any of these problems, because you can't see behind your own back. And let's get you guys better. So you're looking for the cellulite, you're looking for the valleys and the waves, you're looking to improve your posture, you're looking for the trophodema, which is these marks on your body. So if you wear socks and you get a mark around your ankle, that means that you've got trophodema. If you wear shoes and you get a mark in your foot, that's trophodema. If you wear underclothes and you get those marks on the sides of your body, that's trophodema. So you would want to go and have your body, you want to try and improve your circulation by doing that, and go for full body massage to help improve circulation. You can drink parsley tea, which helps with your kidney extract. And yeah, let's get you guys better. With these limitations, these valleys and these waves, and that you will have limitation in range of movement. And I'll do a separate video on what is full range of movement for each of the joints. And then we'll go through which stretches you need to do to improve your full range. So thanks for watching this DVD. If you like it, go and give me a thumbs up, and give me a rating on Rate My Physiotherapist, or on Google if this has helped you in any way to improve your health. Sometimes a little thing that one says can make a huge impact on a person's life. And let's get this butterfly effect out there so that a lot more people can be healthy and happy and have a better quality of life. That's what my aim with these videos are. So keep watching, keep tuning in, keep sending to your friends and family, keep liking the posts. Let's get a global effect going on here. Thanks for watching. Have a wonderful day. Cheers.